The Austen Riggs Center is really named for Austen Fox Riggs, who is the founder of the place. And we're located in the Berkshire Hills of western Massachusetts, nestled in these hills in small town New England. And Riggs is a pretty unusual kind of a psychiatric treatment facility that really is for those patients for whom other treatment hasn't worked.
So what's unique about Riggs is us having the time and resources to slow down and really take the time to look at the root of people's troubles. Not go for quick fixes, but instead to understand what kept people stuck, and then also to take time to help them get better. And the system of step-down programs at Riggs, in combination with 4 times a week individual psychotherapy with a doctor on our staff, is really set up to help somebody take that time and make those adaptations in an environment that is supportive and nurturing.
One of the things that's an unusual and unique and valuable way that Riggs works is the way that we use medications. We don't just pay attention to the biological, biochemical effects of medications. We also pay attention to their meaning effects. Those can really matter.
The Austen Riggs Center really looks at each individual to see if this would be a good fit. Commonly, we see patients with maybe co-occurring mood and personality disorders, perhaps a history of substance use, often in the form of self-medicating, their mental health issues, but someone who's motivated for treatment, who has found that other treatments just really haven't been enough for them.
At Austen Riggs, when a patient is admitted, they are assigned to a nursing care coordinator who stays with them over the course of their treatment. So the opportunity to get to know somebody and work with somebody over a long period of time, that's definitely a different experience as a nurse here at Austen Riggs.
All patients start at the inn, in the inn residential care with a 24-hour nursing available and all the supports there when the patients need it. When they are ready to move towards more independence, we have the outer programs where patients both work on living independently and also work on certain other tasks. And then when they're finally ready to move out of Riggs more into the community, we have day treatment program and aftercare, so they live off campus but still come to Riggs for services.
Riggs is unusual, particularly because of this unique open setting. This looks and feels more like a college campus than it looks and feels like a mental hospital. And patients come and go with complete freedom. We're trying to help them rekindle, reconnect with their authority as a human being, find their voice so that they can live a self-directed life.
Riggs is really different in a lot of ways. One is the open setting. Is to be in treatment at a hospital and yet have the freedom to walk down the street and get an ice cream cone or go get dinner with a friend or take a walk. And this is, I think, a really radical difference from most locked units, which is where I was before Riggs. You can't tell who the doctors are and who the patients are, or who the nurses are and who the patients are. Like, that sense of we're all sort of in this togetherness is really different than at any other place I'd been to.
We've done a number of published follow-up studies over the years, and each of them shows that despite the fact that people who come here really are people for whom other treatment has not worked, that 70% have good outcomes. And often we're working with people who are struggling with suicide as an issue in their lives.
Because we have the ability to work with people over a long period of time, we see the ways that the treatment has ebbs and flows. And so, I do see people get better, feel better, understand things about their troubles, what brought them here, and find ways to tolerate sometimes what feels intolerable.
One thing that makes me excited about this place is the opportunity to slow down and do deep transformative work. Another aspect of it is the community is really vibrant, and that's both patients and staff.
I think we really stand for a way of working that meets the needs of a world in which we've recognized that it's not simply that genes cause disease, but really there's an interaction between genes and the environment, that adversity matters, that trauma matters, that in addition to what kind of genetic endowment someone has, there's only so far you can go with treatments that are organized around biology. and treatments that are organized around relationships, that pursue meaning, and that pay attention to the voice and authority of the patient are also powerful. We're also looking at how to adapt Riggs to the future and help some of these patients for whom other treatment hasn't worked, and that's what we're here for.